we've seen a bunch of new positions within healthcare focused on the consumer and consumer experience. Health systems are focusing in on access coordination, navigation, and affordability to create a better consumer experience across the board. I sat down with Winjie Miao, the Chief Experience Officer for Texas Health Resources out of Dallas, to talk about the role, her team, and the desired outcomes of the Experience Group. This was from a Health 2.0 conference event where I didn't have a video set up, so I apologize for that in advance. But go ahead and listen to this clip and consider the following questions. How have you seen the consumer expectations of healthcare change over the last couple of years? And what is one thing that could be done in your area that would improve the experience of the consumer?
I think it's an evolution, right? As you think about an organization, your structure, in your organizational structure, and the people you put in different seats on the bus to lead it need to really be in service of what you're trying to achieve as an organization, and in our case, for our community in North Texas. And so when I transitioned from hospital operations over to a role that was known as the Chief Integration Officer, System Integration Officer, it was really to look at our entire ecosystem and figure out how to connect all the dots so that we could be more standardized, more efficient, and more coordinated. That was a big piece of our strategy in the last 10-year strategy that we had outlined. When that strategy ended in 2016 and we said, what does the next 10 years look like? It became clear that becoming consumer focused was essential to us evolving into who we wanted to be as Texas Health. And when you put the consumer at the center, then you start understanding that in order to do that, you really have to focus on that experience of access and navigation and coordination and affordability. And it is an extension of an internal focus that I had as the System Integration Officer, and evolving that to really be outside in and bringing the outside in with the inside out together. And that's really how this role came into being. So I became the Chief Experience Officer in the summer of 2017. And we brought together functions that all by themselves were focused on the experience in some way, or fundamentally supported the experience in some way, but were in different parts of the organization. And somebody once said, you know, if it's part of 8 people's jobs, then it's really nobody's job. And so to take all these different functions, put them all together with one singular focus, and to integrate them all together so that the sum is greater than the parts, was really what the pulling together the experience division was all about, in service of a larger consumer-driven strategy for Texas Health.
But you know, one of the things as we think about experience, the question is, do you just focus on the consumer? And obviously you do focus on the consumer, but a lot of it has to do with the operational complexity that's behind the scenes. Do you end up spending more time trying to figure out what the consumer wants, or is that pretty obvious and it's more time spent on the operation and just trying to ease that burden and to make that experience that much easier for the patient?
It's both equally, because you can design a beautiful consumer experience, but if operationally it doesn't work or it adds steps to the care team, it doesn't matter. You're still not going to deliver that beautifully designed experience. And so what we've learned at Texas Health is it requires a very unique set of capabilities to be able to operationally design and deploy and scale something. And it requires that skill set to be mobilized across the organization. And so we have a transformation office that does just that. Takes large scale initiatives, whether they're consumer focused or internally business focused or clinically focused, and is able to do the change management required, put the implementation plans in place, and really walk through that whole design and deployment process and adoption process so that you get the hardwired change that you're looking for.